So doctor, could arthritis, tendonitis affect people under the age of 40?
Absolutely. So typically when we think of arthritis, we think of older patients, people who've had kind of like wear and tear on their joints and the cartilage is starting to wear down. And that's by and large the most common reason we get arthritis. However, anything that injures the cartilage can also lead to arthritis. So that's another reason why I frequently say to people, don't brush off, your aches and pains, especially if they go beyond a couple of days, because they really are likely to be causing a longer term problem. It's better to know than to just kind of ignore it and wish it away. So for example, sometimes I'll see patients years down the road after they've had like what they thought was a minor sprain, and they actually tore a bunch of ligaments. And now because of the mechanics of the wrist, the way that they're now moving their wrist, they've actually given themselves arthritis inadvertently. And they could be anywhere from their 20s to their 50s, and all of a sudden they start getting this ache and pain that I can't make the wrist go back to the way it was. We can treat it and we can deal with it, but you can definitely get arthritis. That's more of a post-traumatic type issue. Your wear and tear issues do tend to be your older patients, but there's also patients who in their 30s and 40s get inflammatory type arthritis, like rheumatoid arthritis or psoriatic arthritis, where it's basically like an autoimmune problem. Your body's almost fighting off the joint as if it was a foreign agent and not your own cartilage. And that's something also to be, dealt with, not just from an orthopedic standpoint, but also from the standpoint of making sure you follow up with your primary care doctor and a rheumatologist and things like that. And then, tendonitis, that's across the board. That's not limited to absolutely any age group at all. From your just weekend warrior type athlete who's in their 30s and 40s, to your college athlete, to your little leaguer who's now got, elbow problems. All of those things are really kind of tendonitis related issues. So it's across the board. These things can really affect any age group.
Very good to know. Thank you.